Well, metro trains have resumed in several cities of the country more than 5 months after they were stopped with protective measures against the coronavirus. Only asymptomatic people are allowed to board, and stations at containment zones will stay shut. But the big question is this: is that good enough?
After 169 days of staying shut, the Delhi Metro from today has again resumed its operations. But a lot of SOPs and guidelines have been rolled out for the safety of the passengers, including the markings that have been done outside the metro stations. Right now we are at the Rajiv Chowk metro station in the national capital. So what exactly would your journey look like amid this new normal? Let's take a look. Before a passenger can start their journey, first they will have to get themselves thermally scanned here, and if the temperature is beyond the limits, there will be one beep, or if there are three beeps, then a passenger will not be allowed to enter. There will be adequate medical support that will be provided to a passenger. So that will be very, very essential. Sanitization will be the priority for the DMRC and all the authorities that are ensuring safety of passengers. So if any person enters inside the metro station, first, if they are carrying baggage, they will have to get it sanitized, and then they can continue with their journey. Tokens cannot be used to travel inside metro station. People will have to carry a smart card, but in case a passenger does not have a smart card and they have to travel, then they can definitely buy one from a counter. But there is a change here as well, that you cannot buy a smart card through cash. You only will have to make an online payment as far as buying a smart card or recharging it is concerned.
See, more than 5 months of the gap, the 32 metro stations are functioning now today.
Yes.
And it's a great welcome step from the delights and for every one of us.
All the security personnel, especially the CISF personnel, will be wearing the face shields. They will be wearing gloves and will be maintaining proper sanitization. So these are certain changes that you will see as far as the metro station and the frisking is concerned. So that will be very, very important as far as the safety of the workers here, the security personnel here and the passengers. It has started working from today. As you can see, there is not a lot of crowd inside the metro train, but there are markings and stickers everywhere to ensure social distancing and to ensure that there is an alternative seating among the passengers. But on a weekday, on a crowded situation, how the DMRC plans to handle the situation, that will be a very important and very crucial point to see.
मुश्किल हो रही थी, मतलब बस या ऑटो।
हाँ,
ऑटो
बस मिल जाती थी हमेशा?
नहीं, पहले से बहुत है, मतलब भीड़ भाड़ सब एकदम खत्म है।
क्राउडिंग कर रहा
हाँ,
है
एकदम खत्म।
और अच्छा रहा आपका एक्सपीरियंस?
हाँ, उसका तो अच्छा रहा।
So we just took a very small trip in the Delhi Metro on the first day of its reopening. While the metro has only started on the yellow line, but in a graded manner, it will start its operation on all the other lines. However, the biggest point of concern for the authorities will be the safety of the passengers, for which each and every one of us should and must maintain social distancing and adhere by the guidelines issued by the Delhi Metro for a safe and a speedy experience. With camera person Mohammed Kaif, I'm Akshay Dongre for NDTV.
Well, joining us now, Raghav Chadda of the Aam Aadmi Party, Dr. K.R. Balakrishnan, Chairman and Director of Cardiac Services Sciences at MGM Healthcare. We're also joined by the Mayor of Bengaluru, M. Gautam Kumar. I'd like to thank you all very much for joining us. Raghav, it all seemed fairly smooth today, social distancing, checks, it was all clean, all of that. But given the numbers that we are expecting on the Delhi Metro, is there a real worry that COVID numbers will go up?
Look, first of all, if standard operating procedures are followed, if the air conditioning, ventilation norms that have been decided are complied with, and all checks and balances that have been put in place to prevent the spread of this disease are complied with, I don't see any reason to worry. In fact, those who were questioning the plying of the buses when we had started after almost a 3-month lockdown. At that time also, a lot of people questioned that plying of buses may actually lead to the spread of this disease, so on and so forth. And one has also learned from experience that if social distancing protocols, etc., are followed, it does not actually result in the spread of the disease. That's one. Number two, the Delhi Metro is opening, has resumed its services in a graded manner. It's not that all metros will start plying on all stations and it will be a free for all. in an attempt to strike a very careful balance, Vishnu, between lives and livelihoods, an attempt is being made. And if global cities where the outbreak of this disease was quite a lot over the last few months can resume their undergrounds and tubes and subways, I think we in Delhi can also follow some sort of standard operating procedures and start flying the Delhi Metro, which is the lifeline of the public transport system in Delhi, the backbone of public transport in Delhi.
Dr. Balakrishnan, is that explanation good enough for you? Because it comes at a time when people seem to be so tired about social distancing, wearing their masks. In the context of Delhi, the Chief Minister is now on phone. I got a phone call, a recording from Arvind Kejriwal telling people, look, please wear your mask. And this is true across the country, where in Pune, for example, there have been fines of 1 crore in 1 month, and people are not wearing their masks. In this scenario, if we open up metros, right, isn't there a big worry that our health systems will be overloaded?
It's already overloaded. In our hospital, there are...
Please go ahead. Yes, please go ahead.
It's already overloaded. In our hospital, you cannot find an intensive care bed. We're just flooded with cases. So, plus, because the disease seems to have spread to the districts, a lot of those patients who cannot be managed with intensive care in the smaller towns and bigger towns in the districts are being referred to the metropolitan cities. So there seems to be a general feeling that this corona crisis is over, at least in our city, because wherever I go, I see people without masks laughing, and it seems to, I think they're tired of these last 4 or 5 months. So I think it's even more important to be cautious now and be aware of the fact that we are nowhere near the end of this disease.
Okay, 1 second. I just want to go across to Mr. Gautam Kumar, the Bengaluru Mayor. Sir, isn't there a worry that the numbers will go up? Couldn't this have been delayed? I understand you're trying to balance things. People need to survive at the end of the day. But was there ever a thought that this needed to have been delayed?
Yeah, no, but the rapid antigen test in Bangalore, we are doing more and more so that let us know exactly the facts, what is there in Bangalore. The facts are like we are doing more of tests and we are getting the more of results.
No, but what do tests have to do with this? I'm asking you about whether public transportation opening up in this manner is likely to result in people potentially falling unwell. People will be in proximity to each other no matter what you do.
No, I don't think so, because every station they'll monitor the temperature, they'll monitor the they'll see that there is a compulsory sanitization of the hands. I don't think so, and the social distancing will be maintained, sir.
Raghav, no government likes to take punitive steps against their own citizens. But in a city like Delhi, when people are flagrantly violating, basic rules, Arvind Kejriwal has to go call up people in that recording and say, please, please don't do this. What more can you do? Is it not time for you to enhance fining people or something along those lines?
So, Vishnu, a couple of things need to be done to address this issue. First is, of course, to increase the number of tests. As you very well know, in Delhi, the number of tests have gone up from 18,000 to 40,000 tests a day, by far the highest in the country. And the second most important thing is, I do certainly acknowledge, and the Honorable Chief Minister in his press conference acknowledged, that there seems to be a sense of indiscipline, a sense of weariness, a tiredness, lockdown fatigue that people are witnessing. And therefore, as a result, a large section of people have, done away with their masks, or are just simply tired of following the social distancing protocols and norms. So I think it is at that time that it is important that government and all, civil society members remind our fellow citizens that how important it is for us to contain the spread of this disease. And this can only happen by way of an awareness campaign, which the government of Delhi is doing.
No, but what about
But
fines,
quite
Raghav?
frankly, that doesn't mean
Punitive
that
action.
because a sense...
Punitive action.
Well, punitive action, Vishnu, is being taken, as the previous speaker also pointed out. A number of challans are being issued. Punitive action is being taken. The chief minister is sending out messages to every citizen. I think a mixture of all these things need to be done, but merely because there is a sense of weariness in people, there is a lockdown fatigue, does not mean that we should now again go back in lockdown mode, start shutting down industry, activity, economic activity, shopping malls, buses, metros, all these needs to be shut again. All of us need to confine ourselves back into our houses. That is not the solution. And lockdown was never a solution. Lockdown was an ad hoc measure to give time to states to ramp up its public machinery, public health machinery. It was not a perpetual lockdown that I don't think any government has envisaged that. And therefore, I think it's important that lives and livelihoods are balanced. I mean, Vishnu, we are talking at a time when the GDP has contracted by 24% in the June quarter. I mean, people like you and I cannot even fathom the devastation this extended lockdown has caused to millions and millions of people, and the kind of misery that has been inflicted on them. I think a balance needs to be struck. I mean, I fear to say this, with the fear of God, I'm saying this. There could be a time, if we go on with this approach, people may actually start dying of hunger and poverty. So I think a balance needs to be struck. There needs to be economic activity. There needs to be employment. There needs to be food in everyone's plate. And at the same time, lives need to be protected. I'm very happy to say, Vishnu, that the mortality rate in Delhi is below 1%. It's not the lowest in the country. It's the lowest in the world. And that at a time when most of the patients that are being treated in Delhi hospitals, whose figures get reported in Delhi, in the health bulletin published by the government of Delhi, are from outside.
Okay.
So the healthcare facility, the public health machinery has been ramped up under the leadership of Mr. Kejriwal to a point where we are comfortable. We
I
can
take
say
the point that you're trying
yes,
to say, Raghav.
things are in control.
As I wrap this up, because I'm out of time, I think it's nobody's stake that we stop all economic activity. The question is, what do governments across our country actually do to get people to protect themselves? And I'm afraid not enough is being done to ensure, to guarantee that people actually do that. No government wants to take punitive steps, but perhaps that is the need of the hour, much more than what is being done now. It's no longer a question of requesting people. People are not listening. And this is true across our country. It's a huge problem. I'd like to thank all of you very much for joining us. Let's hope that people stay safe on our public transport. It's time now for this short break.